Time is 7:22. Good Monday morning, everybody. You're watching BT. This is fascinating and it affects all of us. Ontario optometrists are rolling their eyes at the provincial government's one-time payment of $39 million after threatening to withdraw their services. Earlier this year, the Ontario Association of Optometrists made the decision to withdraw from OHIP with a deadline of September 1st. Joining us now with more news on how this affects all of us is OAO member Dr. Dina Mcdonald. Good morning, Dr. Mcdonald. How are you?
I'm fine, Dina. Good morning.
Okay, let's start from the beginning. So what exactly is being asked from the government and why from the OAO?
So we are asking for two very simple things on behalf of our members. The first is a commitment on behalf of the ministry to a formal ongoing negotiation process with our association. That's something all other professions have, and we have been left out of that process for many, many, many years. That's the first. The second thing is a commitment to fund the delivery of eye care in Ontario at least a cost recovery level. So we think those are two very fair asks, they're very reasonable asks, and they're very defensible asks. And that's where we stand right now. That's been our position for many, many, many years, and that's brought us to where we are today.
So the province said that they would be giving over $39 million. Is this a Band-Aid over a gaping wound? Is it enough? How does that play out or shake out?
That's a great analogy, and the short answer is no. It's nowhere close to enough. So I will fully admit that on the surface, $39 million sounds like a big number. Mm-hmm. But when you break it down, you realize how inadequate it really is. So there's two ways to look at this. $39 million covers approximately 1/4 of the annual shortfall in funding optometry services. So this one-time payment covers approximately 25% of the annual shortfall. This is also a one-time payment for services delivered between 2011 and the present. So it's a 10-year time period. Over that time period, eye doctors in Ontario have delivered about 34 million services, which means this $39 million payment is about $1.15 per service. When you look at the fact that the ministry is only funding about 55 or 56% of the cost of delivering a service, $1.15 is literally a drop in the bucket that will do nothing. And perhaps more importantly, this is a one-time payment, does nothing to address sustainability going forward, which is really our concern, is that vulnerable Ontarians will begin to lose access to very important services going forward unless the ministry commits to a sustainable funding model for optometry.
So who will this affect the most? Because you're hearing kids, right? They're using their screens all the time. They're needing to see the doctor more. 65 plus. Seeing your eye doctor is so important for preventative measures of problems that might be coming down the pipe. So who is this affecting specifically?
So essentially anyone who's covered under OHIP, which are children 19 years of age and under, seniors 65 years of age and older. They are both covered for an annual optometric eye exam, as well as adults with certain qualifying medical conditions, things including glaucoma, retinal detachment, diabetes is a big one. So these vulnerable members of our population will lose access to very important preventative eye care effective September 1st.
And Ontario has one of the most populated provinces in the country where the least funded. This is just unacceptable. This is a basic need. So how do we help? What do we do? Because what's going to happen come September 1st? Are you saying some people are no longer covered?
So come September 1st, the majority of optometrists in Ontario, 96% of the optometrists in Ontario voted in favor of withdrawing from OHIP on September 1st, unless these two very basic requests are accommodated by the ministry. And so those vulnerable people will lose access to OHIP insured eye exams.
Wow.
And what's really interesting about this is a lot of my patients have said, well, no problem, Derek, I'll just pay for the exam. But unfortunately, under the Health Insurance Act of Ontario, if you are an OHIP insured patient, OHIP is the insurance of default, and optometrists aren't allowed to accept any other form of payment for an OHIP insured patient. So these patients can't even use third-party insurance or their credit card to pay for a service they really value and want to get. We know that our patients value these services. We have overwhelming support. There's been 130,000 emails sent to the Minister of Health and the Premier. The activity on our saveeyecare.ca website has been exceptional. So we know that optometrists are in favor of this action. We know that it's unsustainable, and we know that our patients support us as well. We simply need the elected officials within the Ministry of Health to step to the plate and do the right thing.
Everybody go visit saveeyecare.ca. Also write an electronic letter to your MPP. Tell them that eye care matters to you. Dr. Mcdonald, thank you so much. We don't want to see 2020 hindsight on this one. You're already projecting a not pleasant future for all of our eye health. So we got to get on this right now. Thank you so much.
And thank you for having me. Have a great day.